So did you guys see that, Brian Kemp in Georgia is opening the state up, right? Like he's the first governor to like fully get behind that and open up all the bars and tattoo parlors and blah, 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 blah.
Right.
Yeah, it's time.
Did you see what Trump had to say about it yesterday?
Yes.
So
I didn't.
Trump, I'm going to just read it verbatim. Trump says of this decision, he says, maybe you wait a little longer until you get to a phase 2. So do I agree with him? No. But I respect him and I will let him make his decision, Trump said at a White House press conference. Would I do that? No. But I'm going to let him make his decision. But I told him, I totally disagree. Like, this is, I think, my favorite part of, like, the MAGA crew. Because you know that by, being the first one to open his state up, Brian Kemp thought he was getting, like, bonus MAGA points, right, with Trump, who has been, like, just in case people listening are not aware of this, which you most certainly are, Trump's been super vocal about, like, let's get things opened up as soon as possible, blah, 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 blah. This is, like, the clearest case of, like, MAGA whiplash I can imagine, like, I can possibly imagine anybody having. Like, can you imagine if you were, like, so, hey, I'm gonna do this thing. Like, we're gonna be the first state to open up this stuff. It's gonna be great. Everybody's protesting. I'm gonna be at the head of this right-wing movement. And then the dude who is leading the movement turns around and is like, nah, it's a bad idea, dog. Shouldn't be doing that. Like, I fucking can't handle it. What must Brian Kemp be thinking right now? Like, fucking great. This is just great.
He's pulling his face out from underneath that bus wheel. That's what he's doing.
Yeah.
I feel like maybe he's sitting at a bar surrounded by people crying.
Right. No, 100% he's not. Like, none of these people who want to open this shit up, like, are planning on going to the bar. I want other people to be doing that shit.
Yeah.
Right.
Totally.
But no, I don't know. It's just funny to me because it seems like there's, like, this weird, like, being a MAGA person, you have to go along with a certain amount of, like, wait, what are we mad about? Okay, are we still mad about that thing? No, now it's the opposite. Wait, Trump changed his mind. Let's go. And, like, being a government official who's trying to govern according to, like, that premise is fucking hilarious to watch. Like, I just can't. Like, Brian Kemp must have gone home and just gotten fucking wasted. Like, are you fucking kidding me, man? Like, what am I supposed to be doing?
Yeah, well, Trump is just so unpredictable. Like, you just don't know what he's going to say from day to day. And so in as much as, like, were I Governor Kemp, not related to him, by the way, I would be like, oh, I think he'd probably, think that this is a good thing that I'm reopening my state. And then Trump says, oh, yeah, that's dumb.
Yeah, it's a dumb idea.
And then the next day, Trump is like, hey, what if you inject yourselves with cleaning agents?
Yeah, with disinfectant agents.
Yeah.
Dude, it fucking rules. We are truly, what a time to be alive, man. We are truly privileged to be living in this era of, like, human progress. It's so good. The world's most powerful man. A man who has, like, a nuclear arsenal that could destroy the planet 1,000 times at his fingertips goes on TV and says, maybe we should inject ourselves with disinfectant chemicals. Fuck. It fucking rules.
The dumbest timeline.
That's so good.
We're dead.
Truly.
We're right in the center of it.
It's so good.
I just don't understand who put us on this particular path, but I want Doctor Strange to find our way off of it.
I'm waiting for somebody to be like,
making sense.
Yeah,
like 3 years ago.
Who's gonna finally say, like, oh, I get it. We're in the bad place.
That's what I loved so much about that show, though, was that the whole time you were like, wait, is this the bad place?
Right. Yeah, it definitely feels a little that with, like, Truman Showy. Like, who's gonna flip the switch?
It's so
when
good.
is this all gonna be over?
Dude,
I mean,
America
I'm done
fucking
with it.
rules. It's the coolest.
Yeah.
We're the best. Number one.
I mean, just enjoy the ride, right?
USA.
Nothing else we can do.
USA.
I've been watching a lot of
first,
Sopranos, and every day I feel like I'm quoting Tony, just like, well, what are you going to do? Okay. What's next?
I can't.
All right. Well, you guys want to get started up?
Sure.
Yes, let's do
can't
it.
Wait for that.
All right.
Boy, you said the thing voices, some from those dead, all the voices heard. Voices, things we say, voices, they're in your head, all the voices heard.
Why, hello, everyone. You've got Kempa.
And Skylar.
And Shannon.
And Flo.
Full house.
All right, the gang's
welcome
all
back,
here.
Shannon.
Thank
Yes.
you. I'm so happy.
We missed you.
Mhm.
I missed you all too. I enjoyed the singing from Flo last week or last episode, and the begging for me to return.
Yeah. Well, that's that's
felt
how
it.
we got to wish you a speedy recovery. On
Yeah.
the show.
Yeah.
Yeah.
Hopefully we'll get there soon.
Well, should we dive right into that? We thought that it might be good today to. You said you would be open to kind of discussing what it is you've been going through, trying to navigate the medical system during the middle of a pandemic and what that's been like for you. So tell us what's up, where you been, and how's it going?
I've been on the phone a lot with Kaiser. So I guess context, like before pandemic times, I had gone to the doctor about some concerns with like digestion issues. Over a number of appointments, it was determined that I've got some I potentially have gallbladder issues, right? So my doctor set me up for an ultrasound. I was like super excited about that because I'm like, answers, right? So then I get a call from Kaiser that's like, nope, you don't get to have your ultrasound because it's not essential.
So around what time was this? Was this last month?
Yeah, it was last month. It was, yes, last month.
So the lockdown had just begun.
Right. So it was early March.
Oh, okay.
Ish. Or no, I guess it would be mid-March because the lockdown was like March 17-ish.
Okay. So the hospitals at this time, sorry, just for those of you watching, my dog is sitting next to me. So so the hospitals were just beginning to change their protocol, realign their focus on Olive, don't lick the mic.
She's so cute.
onto I'm sorry, I can't focus right now while she's doing this.
Got a special guest on the show today.
I know. This is Olive.
We'd like to welcome Miss Olive.
Yay.
Olive Kempa.
Hooray, Olive.
Hi, Olive.
I love her side eye.
Olive, look at this. Ooh.
Olive. I love this part of the show.
So this was I'm so sorry. This was the time that the hospitals were changing protocol. They were just starting to prep for the upcoming surges of COVID-19 patients and realigning where all of their resources were going to be going. Once this started, they started saying, okay, we're going to push aside non-essential activities for other people, right?
Right. Yeah, I mean, I don't know. Flo could probably speak more to sort of how that rolled out in hospital systems and why.
Yeah, typically the idea was to try to avoid as many things that could potentially be put off. So that wouldn't mean that you couldn't get other surgeries or other procedures that weren't coronavirus related. It's just that if it was something where, waiting until this ended or until they could kind of better assess the hospital capacity, that would be the preferred way to do things. And so just as recently as this week, we've seen that part of the state of emergency repealed. So you can begin to do some of those things that were previously determined to be elective. And we don't mean elective as in like, I just want a slimmer nose or higher cheekbones. We mean elective in terms of just like the timing of them. So there's still medical conditions that are serious and that need to be addressed, but there won't be life-threatening if you wait longer.
Right.
Yeah, so that's where I found myself, right? Where I was waiting and I actually didn't get much explanation. I figured out why my appointments were being canceled. It's, obviously there's a pandemic. So, I got the call last week that I could come in for the ultrasound, and I did. And so that experience was actually really interesting, and it sparked like this anxiety in me that I didn't know I would have. Um, so outside of work and the grocery store, I don't go anywhere. So entering into a hospital setting was pretty scary. But there's like a checkpoint, and you sanitize your hands and wear a mask, and the people allowed in the building are wearing these like stickers, and like I was at the downtown Kaiser, just like all of the precautions. I felt just like very, very safe. But I realized that I suddenly had this like reentry anxiety about like interacting with people who weren't my coworkers or my spouse or
Yeah.
grocery store workers. So yeah, I go in for that appointment, and it was timely because I had called out of the show. From having a pretty severe gallbladder attack the night before we recorded, and that shit just like, I had no idea how horrible it is until it started happening to me. So this is another thing that like when the appointment started to get canceled, I was really concerned because I had had a few attacks and was like really struggling with the pain, and
Right.
and I had called out of an episode before, I had called out of work before, all of these things. Anyway, so I was able to get like the ultrasound part taken care of by like, making the calls and sending the messages that I was struggling. But like that point forward to today has been a complete fucking nightmare. And as a person who like has resources in terms of like being able to connect to I have a primary care physician. I have a cell phone so I can make phone calls. I have the internet so I can send messages. Like, I have in my social support, I have doctors and nurses, so I am in a situation where the resources are there, but I just couldn't get through to people. Like, it turns out that my doctor was on maternity leave. So I was like, what do I do now? Because my doctor's on maternity leave. I just had an ultrasound. What the fuck? So like every phone call that you make to Kaiser is just this very lengthy recording about the coronavirus. Like all of this information that I know that you have to listen to every time you are directed to a new department.
Oh my God.
So it's a fucking nightmare.
That's weird. I've heard so many great things about Kaiser. Weird.
Uh-huh. Yeah. I am like, so here's the thing, that what's coming back to bite me in the ass is that the reason I switched back to Kaiser like 3 years ago is because I was like, I'm not a person who goes to the doctor a lot. So I can just like send them messages through the app. I can get same day appointments. Like, this is the business model of medicine is ideal for a patient like me. But all of a sudden now I'm a patient who like requires more. I'm living with these conditions now that like I need more more support than I did before. So I can't imagine if you're a person like living with a chronic illness or like a diagnosis that requires like frequent interaction or engagement with medical professionals, like how this pandemic has really just fucked things up for you. Like, I was able to get a same day phone appointment with the doctor that was a total asshole. And at the end of that, it was like, not only do you have multiple gallstones, but also you're on the road to like cirrhosis. And I was like, wait, what? Like, I feel like I need a second opinion. And she was real upset about that. So like filing a grievance against a doctor, and then like being and and that's another thing. I'm someone who has resources, so I can say, like, fuck that. You don't talk to, I mean, that appointment in general was really rough because I was treated like shit. And anyway, I was told to like rush to the doctors and like have all this lab work done. But I'm someone who can say, like, fuck you, I want a different doctor.
Right.
But that's even taking time. Like,
Right.
just like everything is really, like, the system is completely clogged. And I'm not, like, I understand that we're living through a time that requires that medical professionals' attention is drawn in other places. But like, as Flo has said, there are still those of us who are living with health conditions that require like acute attention, right? Like, and so give it to us.
That's that's what surprises me a bit. The fact that your gallbladder condition, the fact that you might have to get it removed, that's considered non-essential. You know, my former partner had hers removed when we were together, and it came out of nowhere. She woke me up at 3 a.m. screaming and in wild pain, and we had to rush to the ER. And I just remembering how severe that was for her, and I would imagine you went through the same thing. I'm surprised that the bar for essential versus non-essential is much higher than I initially thought it was.
Yeah, I mean, I think the other thing in my experience that plays into this, honestly and unfortunately, is I'm a person that lives in a larger body and I'm a woman. So doctors don't listen to people with those two boxes checked, right? Like, I've done this, I shouldn't generalize, not all doctors. But women's pain is often not thought of in the same way as men's pain and discomfort. And if you live in a larger body, like, that doctor didn't, like, any of my appointments, none of them saw me. They were talking to me. So they were looking at my chart and they saw a number and decided that they knew what my life looked like based on the number that is attached to weight, and didn't ask any further questions. And so I think that has really played into the way that I've been treated as a patient. Like, on the pain scale, when I described the pain from early Monday morning, like, I had an attack from like 1 to about 3:30, and I was like, it was like a 15. Like, it was so bad. I used to get monthly spinal taps, and I would rather have that done than experience this pain again. Like, and they were just like, okay, well, you just have to stop eating such fatty food. And I was like, I'm gonna freak out.
Yeah, that's rough.
And I think part of it is that they're also not having the conversation with you when you're experiencing the pain. So then when you say after the fact, like, oh, it was a 15, they're like, you're fine. Because, I mean, the thing that you, I think, failed to include in your description of yourself is that you're also a woman of color. And without looking at you, you have the last name Dominguez, right? Like, you are going to be automatically presumed to be able to tough it out, to possibly be, you know, to not be reporting your pain correctly. And we have documented studies about pain that calling it with the exact same symptoms is dealt with differently based on your identity.
Yeah.
Yeah, it's something that, like, I have known, you know, based on exposure to like studies and all of that. But as a patient, again, I'm not someone who goes to the doctor very often. And so I'm not like equipped with the tools really to advocate for myself in the way that I should have been. No, I shouldn't have to advocate for myself in this way. But because we live in a space where there is just like systemic bullshit, I just wasn't prepared. Like, my toolbox was empty, and I have walked away from a number of appointments just like, I mean, the first one in particular, just crying. Like,
Mm.
I mean, I was like, I need a liver transplant is what it felt like to me.
Right.
And that's not I know that's not the case, but like, so and the thing that I often think of when I'm experiencing situations that are, you know, like if I have to like call my credit card company, or if I have to call a doctor, or call my landlord, whatever, I'm thinking like, how do people who have less than I do in terms of their resources deal with these situations? Because a person who, you know, can articulate what I'm thinking or feeling relatively well and knows how to operate a phone and a computer, like my literacy around phone, computer, typing an email, reading emails, all of this, like being able to access information, I'm there, right? I've got all of that stuff. And I was struggling. Like, how do people in poor communities, how do people experiencing homelessness, like
Right. People who don't speak English.
all of this, like, how are they dealing with accessing the care that, I mean, a lot of folks are needing, you know, like there was someone at work the other day who had a blister the size of a fucking tennis ball on the bottoms of both of her feet. And she had mobility issues. So we're like trying to help her get connected to services. And she was like, I just didn't know what to do. Like, and that's it. You know, folks are just left out there to fucking die. Like, I don't know. Like, I can call I mean, I got myself to a point where I was calling, I just like had Kaiser's webpage up, and any fucking phone number that was listed, I was calling them and giving them my medical record number and saying, I got to talk to somebody because I wasn't treated right. And we got to figure this out, you know? And so it took a couple hours, but I can do that, you know?
Right.
It's fucked up.
Yeah.
Also, I can't drink alcohol anymore. I'm really mad.
I'll drink for 2 tonight. Shannon.
Yeah, same.
Thank you. Thank you.
But I mean, Flo, you're sort of a national expert on some of the disparities in healthcare, as far as like, you know, like racial demographics go. Can you flesh out a little bit more what you were saying on how doctors may have biases toward answers from particular people?
Yeah, there are 2 things I think at play here, and I'm really glad that Shannon brought up, you know, being a person in a larger body, because part of what we also see in the healthcare community is what we call an obesity bias. So it basically means that people who have an official diagnosis of obesity, and it's not even like, there are a lot of people who fall into that category who you may look at them and not necessarily see. So
Right.
When Shannon was saying like, they're looking at the numbers on my chart and making decisions about who I am, right? That obesity bias means that everything you're going through is often attributed back to that must be the underlying reason why, even if it's not. And I thought there was a really great episode of House that was on when that show was on, where this guy came in and he was incredibly heavy. Like he was, you know, several hundred pounds overweight. And he kept saying, it's not related to my weight, and I'm going to leave here if you keep, you know, insisting that it's diabetes, that it's vascular, that it's this. And it turned out it wasn't. But he had been overlooked so many times in coming to get healthcare because there is that bias. So that's a very real thing. In addition to that, a very real thing is that there is, because of racism, there is this expectation that it tends to affect more Black and Latinx populations, that because of the more domesticated roles that have been played historically in both communities, that there is this kind of the bias is not just against the group, but in a particular way, which shows up as this community is more resilient, is more tolerant to pain, is in some ways more animal-like in their approach. So like pain is not perceived as being as important in these communities. So Shannon is at the intersection of these multiple identities, and it very much, we have data to show that it shapes how patients coming in with the exact same symptoms and even trained actors who will come in and use the exact same words are given differential diagnosis based on their identities.
Yeah.
Ugh.
And so
again,
I start by
that's
saying,
all-
as much as we know that, it fucking blows. So I'm really sorry. And, you know, that you're like sort of living out a worst case scenario in terms of this care. I'm really
and all of
sorry.
that is true during the best of times, right? Like when there is
Exactly.
a pandemic,
Yeah.
that's like taking up all of the medical oxygen in the room.
Yep.
Right?
Yep.
Yeah, I think I just keep like I just keep going back to the thought that like how do we equip people with the tools to navigate this system right now? And I'm not sure that we know the answers because we haven't experienced a pandemic in our lifetime. But I think that like it does bring up the question of like how people can advocate for themselves as patients, which is a huge task when you are already experiencing symptoms that are impacting your life in such negative, painful ways, right? Then
Right.
all of a sudden you also like your body hurts. Like I have been physically uncomfortable since Sunday, and I take an anti-nausea pill all day long because if I don't take it, I had nausea for like 3-4 months. Like I was taking pregnancy tests thinking that my IUD had failed me for months because I thought like that's what was going on. And my doctor was just like, well, you're not pregnant, so don't know like what the problem is, like, so it's a lot of brushing this off. And this has been going on for a really long time. And then, we get to this place where now I have to take a pill to make me not feel like shit while they figure out what the fuck to do to help me. Like,
Are they finally fucking moving?
I have like it's with Kaiser, I guess it's called like a surgery clinic. So on Monday, I'm meeting with the surgeon, the team of people to talk about like the results. So I mentioned before I was sent like very quickly to go have lab work done because this doctor was talking about my liver function being very poor based on the ultrasound. And I was like, I'm not a doctor, but I feel like you can't know that based on an ultrasound. Like you could see that there's something wrong, but how do you know how my liver is functioning based on an ultrasound? I mean, I watched Grey's Anatomy and I also watched ER. So
These motherfuckers didn't know who they were fucking
Right.
dealing with.
They
right?
don't know me.
Half of Scrubs.
Right. I was like, I'm going to come through here with my like Dr. Green knowledge from back in the day. Anyway, so I did that. Like I go to the doctor, get my fucking labs done. And they wanted like that same day, we're going to book you all the stuff. And I was like, hold up. Like don't we have to like wait for results? And then like, do I have options? Like, because if I have an option for the next 6 to 8 months to just eat kale and brown rice and things will be better, like, and if I can control any of this with like changes to like my daily activity, my diet, like I'd be willing to try that, before you cut into me. I don't know. I just want to know what the fuck is going on. I got some questions. You're trying to put a knife in my body.
Right.
Right.
So I ended up like advocating for them to push that appointment. But it was like either have the appointment later today or have it Monday.
Yeah.
So, which I think is better for me, honestly, because again, I get to like use my resources and my privilege to like look into how to advocate for myself. And like, I'm reading up on websites and talking to people and like, what are the questions I should be asking? Like I put something out on my Instagram today and I've had so many people respond with tips and, here are the questions that have worked for me in the past. And all that kind of stuff. But I am still, I just, like, I want to make a toolkit now for people who struggle to get through to the fucking doctor, because this is infuriating.
Yeah.
And it's like dehumanizing. Like, I'm experiencing something that is like very different to my normal routines, and it's clearly medical. Help me. Like,
Right. Well, that's the scary part about medical shit, right? Especially if you're like in a bunch of pain, because you kind of get to a point where you're like, dude, I'm like locked, trapped in this body with a fucking gallbladder that's like off the fucking chain, and like maybe a liver that's also fucking me up. I can't fix it myself. I need
Right.
help. And the people who are supposed to be helping me don't care. That's a terrifying fucking space to be fucking living in, you know?
dude, this is the kind of shit that, like, one night I was like laying on the floor in the front room because it's the only place that I could find comfort, and I was like, this is how people get addicted to pills, like, because no one is listening to them, but they're able to get their hands on some fucking pills, and it makes you feel better, and that's how you do, like, that's it. That's my trajectory in life, like, because I just need to find comfort, like, you know, I mean, I went down all the fucking rabbit holes.
Yeah.
It's
I don't
fucked
know.
up.
I wish that there was some way I could help, but I don't know. I get so mad hearing stories like this. But you know, we're here, whatever the hell we can do for you.
Absolutely.
I'm
And
gonna start
And you
giving
know that's what makes it worse, is that, like, you know, you've gone down this rabbit hole and you're imagining all these worst case scenarios, and the thing that's true is that that's happened to a lot of people, and then they end up
Totally.
trying to self-medicate, and then when they
Yeah.
show up for healthcare, it's like, oh, you're just drug seeking because,
Right.
and it's like,
Right.
well, yeah, but nobody ever goes back for all the people seeking pain meds and saying, like, but what was the underlying condition that caused them to start seeking these meds in the first place?
Right.
Because what we know so much is that, like, there are a lot of people who are recreationally enjoying, you know, marijuana, and then there are other people who are treating over the counter their anxiety, right? Or treating over the counter something else that is causing them to feel to need, you know, assistance, their insomnia, whatever it is, right? Anxiety. And so we recognize sometimes people are looking for an accessible way to be able to treat what's happening to them. And too often we only look at the symptoms and we don't look at what might be the underlying root cause of this. And I think that's just a challenge in the way that we talk about our lives and the way that we frame, you know, good people versus bad people, right? Like, we're people. And so if we can get to the root of, like, what's harming us, we can usually find pretty good solutions, but so often we don't even bother to ask.
Yeah.
Right. Yeah, it's really opened up a whole can of I'm real pissed.
Yeah.
This thing.
Well, again, like, we're all in your corner, and anything you need from any of us, you have immediately, you know.
I'm gonna start, like, sending my Kaiser medical record number so that we just, like, light up the phone lines with my medical record number.
I should hire one of those planes that, like, flies around with the little, like,
Yeah.
banner dragging behind it with your
it says
with your
"Eat
medical
shit
number
Kaiser" on it.
Yeah. Yeah.
I mean, it's not a terrible idea if you have some people who, like, have time, who can just, like, I'm going to call this number, you call that number, whoever gets through first, we'll three-way each other in, you know, like,
Right.
just give you enough information to get the process started so they can, like, click over and tap you in. But, like, it's really not a bad idea.
That's, like, a good, like, if we've got listeners who are struggling, right, with, like, getting through to Kaiser, getting through to whatever medical healthcare system you are a part of, like, maybe
Right. This
that's a
isn't like a
thing.
shit on Kaiser episode.
No, it's a shit on the healthcare systems that are
Yeah.
failing people.
Single payer now.
Yeah.
Yeah, well, we kind of missed that
yeah,
boat.
we
We
fucked that
didn't
one up,
take that
didn't
off
we?
ramp. So
Gotta keep fighting.
I hope we didn't, Skylar.
Yeah.
I really do, because I think now a pandemic is a great opportunity for, you know, what are we up to now? 26 million people nationwide who are unemployed, who are like, yeah, that idea of tying my health insurance to my job was a really stupid one.
Yeah, let's
that
rethink
wasn't smart
this.
at all, right?
Yeah, but if we had any
because-
leadership who was open to that, I'd be more optimistic about it. But I don't think, well, for one, we definitely don't now. And for two, even if things go the way that liberals want them to, I don't know. I'm not going to go off on a whole tangent.
I don't know. That just sounds defeatist. It's like you just keep fighting for it, you know?
Sure.
Yeah, and I agree,
and
like
I will.
also there are states
I
that
don't
could
think
do
Biden
it
will do it.
themselves. I mean, my hope is always that we find a way. I mean, part of the way that we got the healthcare system that we have now, which is like as bad as it is, it's way better than it was, you know, a decade or more ago, right? And so part of the way that we got that was by a state doing it, that state being Massachusetts, and then it became the model for what was possible. So I would look to, if we don't think we have national leadership, which I happen to agree with your cynicism, Skylar, like we probably don't, and I don't, see that changing anytime soon. Regardless of who wins in November, or if there is a November election, who knows? But, what I do think is that there is a lot of power that can take place at the state level, and that power is not tapped into. And I'd love to see the same model happen for a state doing it, working out some of the issues, and then it becoming a national model.
Yeah. What if California, I think we've got sway here, and that's 40 million people. I think that's a good start. And,
nation state of California, let's flex and do something really meaningful.
Yeah, I mean, that I'm on board for that. Like I like all the more that we can kind of like be more autonomous from the federal government, especially as it gets dragged further and further to the right as time goes on. I'm on board for it.
Yeah. So sorry for like responding that way, but like it like I think it like raises an anxiety in me when somebody's like, well, our ship sailed on universal health care. It's like, no,
it has for at least 10 years nationally. Like it's not happening.
But not here.
Not here. I think, no, that's true. That's true. And that's a fair point. And I am being too pessimistic in regards to state versus federal politics and I recognize that. I don't know. Yeah, I don't know. I guess I'm still bummed out because it looked like we had a shot to do it. And I guess I'm still...
It's our moonshot.
Yeah, still kind of bummed that we're not going to do it. But whatever. It is what it is.
That's a whole episode. Like, that topic alone. Single payer.
Absolutely.
Yeah, agreed.
Well, Shannon, we love you. And it's good to see your smiling face back today.
I got myself a real delicious beer before all this shit. Can't drink it.
You can't, yeah.
Hey, you know what though? But that's the light at the end of the tunnel for you. Like as soon as everything is done for you, you got a little treat waiting for you at the end.
Yeah,
of the day.
shit.
And if it gets to a point where you just can't look at it any longer,
drop it off.
Just send it on my way.
Is that what you're?
That's what a true friend.
I'm just here for you.
I'll drink that beer for you, Shannon. Don't even worry.
All right. Well, should we move on?
Yeah.
Yeah.
Okay. We wanted to discuss a little bit some of the protests that went down throughout the state on Monday, because it wasn't just here at the state capitol. There were protests throughout the state. We wanted to discuss some of the, let's say, the type of people who were at these rallies, and how they sort of interacted with other elements of the public and in particular elements of the media. Flo, what was it you were calling the protest?
Well, on Monday I was referring to them as the annual meeting of the White Citizens Council.
Right.
But now thanks to, because the internet is undefeated, thanks to social media, the term flu klux klan is floating around, and I love it. I love it. It's the best. So the flu klux klan.
Well, it joins this great list with like Y'all Qaeda and Vanilla ISIS.
Vanilla ISIS, yes. love
I think the
all of
Ku
those.
Klux Klan, yeah, fits right in there.
That's
Ku
up
Klux
there.
Klan.
So good. I
Oh
love it.
yeah. Well, there was a lot of discussion on who was at these events, and again, these were the protests on Monday dedicated towards fighting Governor Newsom, trying to get him to reopen the state. They disagree with the stay-at-home mandate.
Well, and it wasn't just Monday, right? They were there on Wednesday, and they're supposed to be back. Well, when you're listening to this, they're supposed to be back at the Capitol Friday, so today.
Yeah, about 20 people showed up, 20 to 30
Right.
On Wednesday. And again,
Let's hope that's what it is on Friday as well.
we're not practicing social distancing. I think I saw one person with a mask on. What did you all sort of do some reading? Did you find out kind of what political subsets of the population this was made up of?
Dummies.
Yeah, I mean, my understanding is that it's like a combination of folks who are anti-vaccine and who are worried that the shelter in place or in general the physical distancing recommendations are going to stay in place until a vaccine is developed, and that vaccine will then be required, which they are obviously always against. So I know some of those folks are out there. Then you have some of your general Trump supporters who really feel like the economy should get back going. I know we saw Confederate flags out there, so I don't know the Confederacy is still alive. I'm not sure who's decided that's their banner today, but go 1862. I don't know. And then apparently a coalition of small business owners that feel like they won't survive this time, and so they want to get back. Some of them include, hair salons and nail salons and those kind of places that really have no way of being able to convert to like an online model, right, or do things from distance, and want to get back and feel like in California in particular, some of the arguments have been our numbers aren't as high as they are in other places, and we're not, confined to the same sort of tight geographic quarters that places like New York are, New York City in particular. And so they feel like it's much easier to maintain physical distancing. And so they're proposing their own sort of like, we'll only let 3 clients in the shop at a time, and we'll clean things in between, and everybody wear masks. And by not allowing them to do business, we're harming more than we're actually protecting against the virus.
Right. This is the subset that I think infuriates me the most, because they're not sort of these loyalists to these weird ideals. They are to put it in socialist terms, the petite bourgeois, right? The folks that want to put other people's labor to work to make them money again.
Right.
And that one really strikes me as deeply inhumane, unhumanistic, right?
Well, and that's what it's going to be, right? Because whenever, like, I've seen video of people being like, yeah, you want to get back to work, right? People are like, yeah. It's like, cool. Well, there's a bunch of essential jobs that like are hiring right now. Like, we need people. And people are like, oh, no, I'm not doing that.
Right.
Like, I have a family to worry about.
I want to put other people to work.
Exactly.
Yeah.
Like, all right, cool, great.
And then I would say there was a strong contingent on Monday of the QAnon type folks. I saw a good number of Guy Fawkes masks when I was there at the Capitol on Monday. So quite the amalgam of movements.
I mean, it's just a big right-wing event. Like, that's 100% of what it was. And like a lot of the big one on Monday was like a caravan that came up from Southern California. So it's not even like all these people live here, it's like a bunch of MAGA people from all over the state who are having a big freak out.
Well, one thing that I
also
noticed,
feel like some people are just contrarians, right? Like, I feel like some of these are just people who are out here like, everybody thinks it's a good idea to stay home. Well, I don't, right?
Right. Well, it's also like people like the whole so much of the right-wing ideology, and a huge reason why I believe that we got President Trump is that, like, for MAGA people, their entire political ideology is like, look how mad the libs are. Like, this is great. Like, that's it. That's what you vote on. That's what you make your political decisions based on, is how like mad, you know, the libs get or whatever, which, you know, which is obviously stupid on its face. But now we're in the middle of a huge pandemic, and it's like, no, now it's fucking dangerous.
Right. And that population ties in with sort of the Wild West libertarian, y'all don't tell me what to do subset.
Sure.
Yeah.
Speaking of which, I saw this like just before we started to record, so I didn't get to share it with you all, but you may have seen it. There apparently yesterday, there was a case in California around the background checks for ammunition.
I saw
that
this.
was overturned, and so the background checks are now not allowed. And you know, so just thinking about also, you know, I think some of the arguments that we've been hearing for why we should open back up is that the government shouldn't be telling you how to live your lives and what amount of risk you're allowed to take and that sort of thing. And I think that falls in line with that very much in line with the sort of pro-gun movement of, these are my guns, I'm allowed to have them. And we know, I think we even talked about this on the show before, that when this first started happening, they weren't running out, obviously, but in addition to toilet paper and paper towels and cleaning supplies, people were also stocking up on ammunition.
Mm-hmm.
It must be really frustrating to be like a fucking doomsday prepper and be sitting here in a time when like shit has hit the fan. You've got like 18 fucking guns and like 500,000 rounds, and there's nothing for you to shoot to fucking solve the problem, right? Like, it's like the problem is solved through fucking empathy and like a society coming together, like as a people, to say, okay, we're all going to kind of do the right thing here, even though it sucks to get through this thing. There's nothing for you to do with your fucking rifle. There's nothing for you to do with all your 12 handguns and your fucking grenades and whatever the fuck else you've been stockpiling to get ready for something like this. There's nothing to shoot. You know, I have to imagine it's probably fucking frustrating.
But the dark side of that is that the thing they're finding to shoot is the people who live in the house with them. And so I actually just shared an article earlier today about the killer in your closet. And it was shared on Twitter by one of the gun violence researchers at UC Davis, by some of her colleagues, wrote this work about, you know, we're seeing the incidence of domestic violence go up, and we recognize that there are a whole lot of people who are sitting at home unemployed with guns of their own. And so, you know, some of this will turn into violence that shows up in really, you know, harrowing ways.
Yeah.
Yeah. Well, and that's sort of how we were going to, there were a few things we wanted to touch on today with just where is this animus, this rising anger from these alt-right folks going to start being directed. You know, now it's in their own homes. They're also now starting to direct it outward in ways that might be a little more pronounced, a little more public than we're used to. Like, Flo, you said, you know, I'm just naturally, if I see a Confederate flag, I probably won't show up there. Like, it's just,
yep.
You know,
that's always my deal. Like, Confederate flag is a very clear sign that, like, I'm not welcome or safe here, because it's a sign of violence to me. And so if I see it, I won't. I mean, I really appreciate the people who show up to counter protest and who, you know, are able to take on that role, but you know, it's not safe for me to do so.
Totally.
Absolutely.
Yeah.
Yeah.
Well, and then Skylar, you know, you went on Monday and you know, you've got anti-fascist tattoos. You were wearing a shirt letting them know kind of where you aligned, and that's directly against them.
I want to state for the record, for people listening, that's really, like, what I did was really shitty counter-protesting praxis. Like, you should not do that, and it didn't work out for me. Obviously, like, I didn't get attacked, but like, don't make yourself identifiable as an enemy to a big group of people and then show up by yourself. That was really stupid on my part. I would not, right? Like, if you like, counter-protesting is great. Standing up for what you believe in is great, but like, be realistic about it. Bring some friends, have some plans. Don't just do it like I did it. Because I got out okay, but I was lucky, and I would not recommend that other people do that.
You identified the situation pretty fast, it sounds like. But you know, I totally agree that this animus and anger probably would have been directed at you too. There were people who were there. There was a lot of, and I will never say that like the animus against like members of the media is the same as against like, you know, somebody waving a Confederate flag against black people or something. But like there was anti-media rhetoric there, obviously.
That's like a central tenet to like their thing. They, you know, all the media is real bad and out to get you and misinform you and shit.
Oh yeah, there were plenty of signs advocating that, advocating getting rid of the media, however that might look. We also saw down in, I believe it was down in Orange County. There was
Huntington Beach.
During a protest down in Huntington Beach, a man was angry that the local Fox affiliate had been filming him. He allegedly pulled out a knife, forced the cameraman into the TV van, and made him delete the footage that they had taken of him at this very public rally, right? This guy was eventually arrested, but there's a piece of me that like I could totally see that animus being directed at any journalist at one of these events, because
and you know what they're worried about? They're worried that they're going to be on camera, like they're going to go viral, being on camera, being like the Jews will not replace us or whatever, and it's going to get all over the internet, and their fucking manager at Best Buy or whatever is going to call them back into the office the next week and be like, dog, you're famous for being a racist. You got to go. That's what they're fucking worried about, is like having a light shone on them, like while they're fucking in the middle of doing their shit. That's why they don't want you to film them.
And that's why some of them were wearing masks, even though their whole thing is that we don't really need masks and this is all a hoax, and put everybody back to work. Somebody actually posted online and was like, well, why are they wearing masks? And I was like, because they're trying to protect themselves from jobs. Like they don't want to be the Tiki Torch boys from Charlottesville. So that's why.
Right.
The Tiki Torch boys. Nice name. Yeah, well, you know, here in Sacramento, I don't know if you all know Karlos Rene Ayala. He's a young documentarian, super talented photojournalist as well. I always say photojournalists are the crazy ones that, whereas like every normal sane person is running away from the action, they're running directly into it.
Dude, speaking of that, did you listen to that? He just did an interview with Capital Weekly.
Yeah, he was on Capital Weekly discussing a documentary he took that he filmed that day. I saw him in action throughout.
Just real quick, speaking of running towards the action, this dude in this interview with Capital Weekly, he was like, well, it was 420, so I got really high. And then I went to this MAGA rally and started filming people who were mad at me. I was like, what?
That's very Karlos, yeah.
No, dude, abort.
He was, I mean, he's incredible. And he, I will say he was getting closer to people than I was comfortable getting with people. But he made a really, really unique and phenomenal documentary. I think it's up on Capital Weekly's website right now. Basically, he takes sort of the Werner Herzog approach by just asking people fairly simple questions and just getting them to open up and say what they're going to say. That said, you know, he's a brown man, and I believe he said he's from El Salvador on that on the Cap Weekly.
Yeah, that's right.
Listeners, listen to that episode. He's fantastic. But he's, you know, obviously he doesn't feel particularly safe there. He said he felt anxiety the entire time. I did too. I could only imagine what it's like to be Karlos, you know, out there. And he said at one point he was approached by a group of about 10 Proud Boys, you know, the exact people we're fucking talking about here.
Can you kind of describe for some of our listeners who might not be familiar with Proud Boys what that's about?
Yeah.
I don't think Skylar, you might be able to describe it better than I could.
So these guys are like, they're basically just MAGA guys, but it's like kind of wrapped up in this, like, there's also like a masculinity aspect to it. Like, oh, like our, like, you know, today machismo has been like neutered by the Me Too movement and shit like that. And that's all bullshit. And we should be proud of being strong, masculine men. There's also like, and of course that like line of thought kind of factors into like, of course, like, and obviously like, yeah, everybody likes to say that racism is bad, but it's not because of X, Y, and Z. And these guys are identifiable by their like uniform that they wear are Fred Perry polos. So you see groups of guys walking around in the black Fred Perry polo with like gold trim. Those are Proud Boys. Get like, stay away. And they do come to SAC here and there. They come to SAC to do, there's not like, I don't think there's any of, like, I've never heard of like a group of them that are native to SAC, but anytime the alt-right shows up like in force to the Capitol, the Proud Boys are around, and they are the kinds of guys who will like roll up on you 8-1 and kick the shit out of you if they can catch you.
There's a pretty strong contingent of them up in the Folsom area, I want to say, correct?
Yeah. I'm not.
That would not
sure.
be surprising to me.
Yeah. But there, yeah, this.
Why?
I have no idea. I mean, there's actually a kind of a strong white supremacist streak up in that area. I don't know the reasoning behind that either.
It's the same kind of thought process between the fucking the what were they? The Torch Boys from Charlottesville. Yeah. Like, this is the same group of people.
Okay.
Totally. And yeah, so a group of 10 of them came up and started hassling him, and they mistook him for somebody. And he didn't say who they mistook him for, but I kind of think that I know who they did. But effectively, it's somebody who's, you know, a fellow leftist who has done work in identifying Proud Boys and their actions, right?
It's not just identifying Proud Boys, it's exposing Proud Boys, like putting them on the internet and being like, this is who these fucking guys are. Here's their real names.
And letting their managers know that they're racist pieces of shit.
Exactly. Making them famous for being racist.
That's the good work.
So this group came up to him and was like, hey,
the Lord's work.
You've been posting all of our stuff online. And he's like, he basically had to like talk, you know, obviously it wasn't him, A of all, but he was in serious danger in that moment, you know, and he had to walk, like, find a way out of that very serious situation. And when I go and cover events like that, I have my own set of anxieties, but rarely do I think that I would ever be targeted the way that Karlos was. And that's something I think about a lot the last few days.
Yeah, absolutely. Like, all I had to do was zip up my jacket and like I was pretty much invisible, you know? Because yeah, I mean, yeah, I do have a couple of tattoos that like groups like the Proud Boys would understand the significance of. But all I got to do is wear long sleeves, and I can fucking walk down the street with no problem. Somebody like Karlos, or like anybody who's not a fucking white person, you know, doesn't have that same thing. And like, honestly, if that was me, I'd be on Flo's side of this thing. I'd be like, you know, other people can handle this. Karlos is a ballsy dude for like being a non-white person and going out and putting cameras in those people's faces.
Yeah, he's incredible. To a smaller degree, I went out on Wednesday and I checked out the smaller protest. I took a photo of it, threw it online, right? You know, here's 20 idiots being idiots. And it got a few shares on Twitter and Facebook. And on somebody's repost of it, this random dude came on and started arguing about, you know, it. And like, one of the things he was arguing was on like how the police shouldn't have done anything. And so I started comparing and contrasting that with, as we spoke about last episode, the Stephon Clark protest in the Fab 40s last year, right? where the police were wildly violent to a degree that they now have to dole out $500,000 for the damage they caused and the way that they harmed and endangered people, right? And it got to a point, it was like it took all of 12 minutes in this text conversation on Facebook for this person to come up with a wildly racist message response where like effectively all me and this other person had to be was like, oh, well, there it is, right?
Right.
Blatant racism. I don't know if you want me to repeat. I don't know if I want to repeat it. They deleted that comment, but it was like after we exposed this person for what they are, they immediately were like, they effectively threatened me. They said they outed themselves as having been in that picture on Wednesday. They said, I saw you take that picture, and you know, you think you're such a strong Facebook warrior now, you're not going to be, you know, out there in the street or whatever, right?
Sure.
So, oh, Olive, it's okay.
Olive is very...
Don't let Olive fucking
She
figure
didn't
out where
like
these
that.
guys are, man.
Yeah. Did
Olive
you hear
will
her?
shut that shit down.
Could you hear her do it?
No.
Oh, she went.
Aww.
Yeah. But you know that I just think like I tend to forget that that's the kind of shit you're up against. Like these people just like really want to start a fucking fight.
Yeah.
Yeah. Then right now they got nothing else to do.
Yeah.
They absolutely do.
Before I like this is like on a similar topic before we get done, I want to say again, like, so we are in the middle of a pandemic. There was just a rally on Monday that had like, I don't know how many hundreds of people. I've who knows how many hundreds of people were there. I'm hearing like numbers up to 1,000, including the people in their cars. I don't know. I don't know what that is. Way too many people who are like in Sacramento, in the middle of the city, not observing social distancing, endangering themselves and everybody around them. The cops do nothing. Tuesday, CHP puts out a statement that is like, we will no longer be issuing permits for groups to be able to do this sort of thing. That's the end of that. Like nobody else can congregate at the Capitol, which is for one is like, great, dude, this is really great timing for you guys to fucking do that right after 1,000 people just like put everybody. Because here's the thing, and I don't feel like this can be overstated. We're all in danger if those fucking people are around, because you know that statistically some of those motherfuckers are carrying that shit and not taking any measures to keep anybody else safe.
They came from all corners of the state, went back
Exactly.
to all corners of the state.
Exactly.
There's no question in my mind that this thing blossomed
Yes,
out.
that it fucking made the rounds on fucking Monday, and the cops come out and are like, oh yeah, I guess that was bad, so let's not do that anymore. And then on Wednesday, 20 of these motherfuckers come back out. Where like are the like less than 24 hours after the CHP, which is who I guess that's the capital is their jurisdiction. Yeah. Had released a statement that's like, we're not doing this anymore. We're not allowing this anymore. Well, then they did. Like less than 24 hours later, 20 more of these motherfuckers show up. Where's CHP? Why do you think it is that fucking CHP doesn't show up and cite people? At least ask them to leave. I'm not trying to get these motherfuckers thrown in jail, but how about the CHP comes up and is like, hey man, not cool. Fucking disperse. Yeah. Is that too much to fucking ask for? They're coming back tomorrow if what I'm reading is right.
And you said
let's see if fucking CHP shows up then. I bet they fucking don't. And every time they fucking let these dumbasses cruise around and fucking spread this shit around, like, dude, I live in this city. We all live in this city, you know? A lot of the people listening to this podcast right now live in this city and are endangered by this shit. And the people whose job it is to serve and protect you are fucking letting this shit slide, and they will do it over and over again. It's fucking shameful. It's ridiculous. It's like such an abdication of their fucking duty to like to you and me. And I know we rip on the cops all the time on this show because they obviously abdicate that duty all the time, right? Like in a million different ways. But like this is public, like this is on camera. Like what, like for real? You guys are just gonna let these guys do this over and over again?
Yeah.
Yeah.
I mean, this is the kind of shit that like it's infuriating, but by no means is it surprising. Like
Sure.
they are, the folks who are standing out there in front of the Capitol making fucking asses of themselves and putting everybody else, at risk. All they're doing is shouting out all the shit that the people in uniform wish they could be shouting out more loudly. You know
Right.
what I mean? Like they're just holding up all that racist bullshit.
Right. They
And
align
protecting-
ideologically.
Totally.
100%.
Yeah.
Protecting the people that look like them.
And I
Of
know that
course.
people like who don't go to these things all the time think that that's like an exaggeration, or that there's like maybe a few of these guys are bad, but like most of them are really cops who are there to like do a good job and like keep us safe. Dude, come to a MAGA rally and watch shit get fucking ugly. Watch what the cops do. Watch who they protect. Watch whose interests they are trying to serve at any one of these things. It's not
And then
one or
watch
two
the
bad
different
cops.
tone they take when it's a different protest.
Exactly.
Mhm.
It's fucking systemic. It's the entire fucking department. And if they aren't like directly involved, they're fucking complicit in it. And they fucking know
Say
it.
Yeah. And so I just love that this has become a central theme to this show, because it's very important that we continue to carry out this message that these cops aren't helping people.
Yeah.
And you go out at 7
They're helping
p.m.
some people.
Well, right. You go out at 7 p.m. on any given night, I'll be walking my dog or something. There's a fucking cop car in every fucking corner.
Yep.
Dude, they're
This is where our
everywhere.
resources are going.
Right. Yeah. Think about that next time that you're like walking your dog or whatever, and you're out on the street and you see like a homeless person trying to take a nap and there's 8 cop cars rolled up on him. Think about that, and then think about fucking like 20 chuds out in front of the Capitol, like jerking around and fucking giving themselves coronavirus. It's not because the cops didn't know they were fucking there. They fucking know. They just rather hassle fucking homeless people who are trying to take a nap.
I don't know why chuds just really gets me every time. It just
Chuds. I liked jerking around. That did it for me.
so entertained.
Absolutely.
So glad to be back.
Well, just a final anecdotal note, and we're so happy to have you back, Shannon. A final anecdotal note. Today, a friend of mine who lives just off the Capitol, so 4 days after that event, she is sick, and I think she might be going to get tested tomorrow.
Fucking hell.
She doesn't know what she has, but
Thursday was the deadliest day in California we've had so far. It isn't
right. We're
like-
not out of the woods.
We're not even kind of out of the woods. We're in the fucking thick of it.
Yeah.
It is not time to be like, oh, things are great, let's come back outside. It's not where we are.
Totally. Yeah. Fuck.
Well,
This episode was sad.
Yeah, sorry guys, I got real fired up on this one.
yeah. Should we give people a direction to place their rage?
If one of you guys can think of one, I'm open to listening to it.
If you see a cop hit, no.
Uh-oh, we're trying to get Kemba's
Okay.
trying to get the show shut down.
Reel this back in. If you see a cop, don't say hello.
Flo is hiding.
Okay, I can stand. I can stand behind that. Yes.
Yeah, if you
You
see a cop,
don't say hello.
Scowl at them from a
Right.
distance.
I would like to bring up. I mean, I think this demonstrated 2 issues. This whole conversation kind of underscored 2 issues for me. One is that the consequence of us having had leadership that has disavowed the media for so long is that it's really easy now for conspiracy theories to take root and take hold.
Yes.
And that's happening both on the side of, you know, people out protesting right now, but also even in communities where people are not willing to listen to, you know, basic protections because they don't trust what they're hearing because they feel like they've been lied to so much. And the sad thing is you can't say to them like, no, that's not true. You haven't been lied to. It's like, no, they're drawing the absolutely correct conclusion based on a really, really terrible set of circumstances that then has real consequences. And the thing we know is that when people are terrified, they go to their baser instincts, which unfortunately for some people means that they default to their racism and their sexism and their, you know, queer phobia and all of those things. For other people, it means that they go into self-protection mode, which would be fine if it didn't sometimes involve putting other people in danger because your idea of self-protection isn't particularly good or healthy or productive, right? And so I think I'm saying that as just an overarching issue of how do we restore credibility into trusted institutions in some way? And I don't mean, I shouldn't even say restore, I should say, how do we make sure we form trusted institutions that can be sources of information that are set apart from an agenda that people will then feel like is either being advanced or not based on what position they believe, right? Like that used to be the role that we were supposed to see media playing in some respects, right? But because there is so much media at this point, it's hard to distinguish between the commentary parts of it, which are very important, right? Like, let's talk through an issue, from the journalism parts of it, which are, we are reporting on what has happened, and this is what we know, and this is where we need to go. And so I see that as an overarching issue. I don't know what our listeners could do about it, but it just felt like something I wanted to call direct attention to. Like, some of this is what happens. Like, we're in this place in the pandemic right now because everybody across the political spectrum doesn't know who to trust.
Yeah. Well, it's funny that you say that there's so much media because there's at once so much, but also none at all.
Exactly. And
there's no
and what
legacy.
I mean by that is that, like, there's like the fact that everybody has a platform means that we still have people picking stuff up off of the internet and just being like, well, I read that it's the 5G cell phone towers and that's what I believe now, right? Like that's what I mean by there's just so much media. It's like a lot of things are considered to be news sources that are not necessarily holding the caliber of, like, this has been vetted information. And so check the source has been like, I think a running, conversation.
The reliable information is also harder and harder to come by, not just because of this like democratization of voices, through social media, but also because my colleagues in my industry are watching it. It was a dying industry for a long time. I think we can move on and say dead in some respects, in some spaces. Our industry is really fucked right now because their last leg to stand on was advertising, and that's shot out from under their legs now. So you saw the Bee today, putting out all these pleas for just donating to them when they're a for-profit enterprise that charges for subscriptions and ads. Like, this is how bad it is for them. You see the News and Review basically trying to go the Voices River City route now by doing the membership model. They rolled that out today. Like, our industry is in oh shit mode, and there's so little information actually coming out from us right now.
Yeah. And so I think that's just one thing to call out. And then the other thing that I think is important for us to remember is that, like, our city and county and state governments are still operational right now, even if people are not meeting in person. And so that means that budgets are coming up. And some of the things that we'd like to see money put towards, some of the ways that we'd like to see things restructured are going to be, we're going to start to discuss and vote on in as little as a week or two, right? Like, usually it's the beginning of May, depending on where you are. And so I think that's important to consider as well. The city of Sacramento is going to have a budget coming up. The county of Sacramento is going to have a budget coming up. And of course, the state of California has to pass a budget. And so let's not just take the role of, okay, everybody shifted to COVID and that's it. Let's really think about what should we spend money on and make sure that if there are cuts coming, they're not coming to other preventive things that were good for us that are going to cause other consequences, that they're really they're really being redistributed to places that need it from places that maybe shouldn't have been getting money in the first place, or that there is a plan to be able to restore those things after the immediate aftermath of this has been passed. So I think that's an important thing for us all to be paying attention to, is where is the money going?
I love that, Flo. And, where your money goes is a great indicator of what your morals and your principles are. And we should absolutely lean on them for that. I think that's a great direction for us to go. If you want to write out a template for how listeners can reach out to city officials, I'd be happy to share that.
Absolutely.
Well, guys, I know that this has been kind of an intense episode, and I don't want to like add to the intensity or like dump a ton of extra shit on top of like a lot of topics that we've covered that have already been pretty intense. I'm out of work right now, guys. And I didn't want to bring this to the show, but here we are. And I've been spending all this time just trawling through the internet to get all of this great Voices content that I desire and have the time to listen to with all of my newfound time because I'm out of work. But I can't find any more, man. And I know there's more. I know it's not that it's not there. I know it's just that I haven't found it. So Dave, I wanted to ask you, man, I'm at your feet here, man. Where can I find more of this fantastic Voices?
Wow. Well, first of all, Sky, this is the first time you've told us this, and we're here for you, man.
This is such a supportive
We're not
group
laughing
of
at the
people.
fact that he's not working. I just don't want anyone watching this
Yeah.
to see all of us laughing, and we're like,
He
he's
says
really
this
opening
every
himself up,
episode.
and they're such jerks.
But yeah, no, I think that's a fantastic concern. One thing that I think is really exciting about Voices is that we now have a YouTube channel. Just go to YouTube, look up Voices River City, subscribe, smash that subscribe and like button.
Hell yeah.
And you get to watch us and see our pretty little faces in your home as you're doing the dishes or doing whatever it is you need to do. I think that's probably one of the funnest things about what we're doing right now. But we're also at voicesrivercity.com. We've got a lot more coming out. I've been saying this recently, but like we got to start editing those essays. And I'm really excited about those coming out. Open invite to community members who want to do some essays too. Reach out to me. We are on Instagram at Voices River City, and that's really, really fun too. We are on Facebook, Voices River City. But yeah, check out our website, check out our Follow the Money project. I'm going to be doing some stuff on the two city council races that are going to be coming up in November. So keep an eye out there. And then each one of us is on Twitter. We're all a little silly. We're all a little sassy. I am at Kempa.
I'm guillotine for you. That's guillotine the number 4 YOU.
I am Shan N.D. Stevens.
And I am Flojaune. That's FLOJAUNE.
And that is us. As always, thank you to Be Brave Bold Robot for everything you do. Dean, I miss seeing your smiling little face as you walk through Midtown on your lunch breaks. But Be Brave Bold Robot, that's the music. Check them out. They're a very fun band.
Yeah, and we have kind of been picking up some listenership, so it's clear that people have already been kind of doing this. But if you're listening to this and you like it, tell a couple of your friends. It'll help us out, and it'll spread the thing that we're trying to do here. It's really like it's exciting because I feel like this is going from just like 4 people kind of having a discussion and turning into a community. And I think that's like the biggest aspect that I'm the most excited about this entire thing.
Yeah.
Same.
So
Yeah,
tell
totally.
your friends, if you listen to us on the podcast app on an iPhone, give us that 5-star rating and write a review. That helps other people find us. We plan on doing some hangouts too on Zoom, so keep an eye out for that. And again, I forgot to mention this, but we're on Patreon, patreon.com/voicesrivercity. If you don't have money, don't worry, but you can pledge as little as $5 a month.
And we have swag that we'll throw at you if you do become a pledge.
I will throw a coffee mug at your head.
Dave will come to your work and just nail you with a coffee mug when you're in the middle of a presentation.
Yeah.
From 6 feet away.
Yeah, at least 6 feet.
It's because of social distancing that we have to hurl things at you.
I've been working.
He'll be wearing a glove when he throws the mug.
Yeah.
There's mug-shaped holes in all of the walls around my apartment because I've been practicing.
All right, guys. Well, hey, everybody, be happy, be healthy, be safe, and yeah, we'll see you Tuesday.
All right, thanks for listening.
Yes. Bye.
Bye.